Smith sharing with Deputy Coppinger.
I want to welcome the Sinn Féin motion and just to say that we all know that the solution to this isn't one based in IT. It is not one based in software or even in better administration, bad and all as the administration is. Because when you look at the cause of the health crisis and the waiting lists, it's not caused by unfortunate incidents that somehow result in thousands and thousands of citizens left to languish on lists for an eternity, but it's the outcome of political decisions that prioritise certain interests over others, decisions taken here by this government and the previous one and the previous one, Fine Gael and Fianna Fáil-led administrations that pushed privatised healthcare over and above the healthcare for the public, that put recruitment bans in place during austerity and cut bed capacity repeatedly and accepted and enthusiastically enforced neoliberal management models that saw a mushrooming of management structures and a diminishing of frontline services. We have a public system that's designed to fail in order to frighten people into taking out private healthcare insurance. The guarantee you get by taking out private healthcare insurance is that you'll be seen first and you'll get a diagnosis faster than you would if you remained in the public system. The private system and the profits that accrue to it would not be possible if we did not have a failing public system. A person born into a lower socio-economic group has on average 4 years less to live than somebody from an upper professional group. And the higher rates of lung, stomach and cervical cancers in deprived areas mean there's a lower chance of survival. The real scandal is, though, that these facts have been known to us for a long time, but the political establishment deliberately devised health policies exasperating this situation rather than reducing the health divide, never mind the class divide. There's no strategy to increase the life expectancy of the poorest groups in Ireland. The reason that the health system is based on this is to encourage a certain sector to profit from human misery. And we can scratch our head and seek solutions here, but we could start maybe by accepting that cuts to pays and pensions and the increased working hours of the frontline staff like nurses, etc., doesn't help. Because ironically, as we wax lyrical about the great efforts that Simon Harris and the government are planning, Pascal Donoghue will come in here next week and he will tell us that we still have a financial emergency, and he'll pass another year of the FEMPI legislation that maintains inequality and division and keeps public servants in the hospitals, etc., on lower rates of pay. But I want to deal in particular with one area that isn't covered, and it's one that's very familiar to a lot of parents, and that is that the assessment needs of children are in a dire situation. Just 25% of the assessment of needs was completed within a 3-month time frame provided for in the regulations, versus a target of 100% by the HSE. A High Court judge earlier this month made orders of consent giving the HSE between 6 to 8 weeks to complete assessments of health and the needs of 12 children with suspected autism and other conditions. Now, one example of how profound and telling this failure is a young lad called Carter Keogh from the Coombe. He's 3 years of age, seen by his GP 7 months ago, then seen by a developmental paediatrician and referred to the very badly named early intervention team. He was told, his parents were told rather, they would have an appointment at the end of 2019. Now, it is not rocket science to know that the earlier one intervenes with children like this, the better the outcomes. And as soon as the intervention is made, then and the diagnosis is made, then getting the services, the speech therapists, the psychologists, the intensive frontline services that are required to make a difference to this young man's life and indeed to his family's life. The state is completely failing thousands of families in this area. And it's not an IT problem, it is a systemic problem that makes decisions over resources. And I just want to finish by looking at the shocking resignation of 3 consultant psychiatrists in the South area. And to quote Dr Kieran Moore, who addressed the Joint Oireachtas Committee on the Future of Mental Health Care and told us that he and 2 of his colleagues were resigning. I'm resigning from Wexford because it's untenable and unsafe, and 2 of my colleagues are doing the same. He said patients are coming into a building that is in a state and where staff are burnt out. I think that says it all, and he has just been awarded a pay increase. He and 2 of his colleagues have resigned because of the state of the health service.